मरहबा, हेलो एवरीवन, नमस्कार। आई एम डॉक्टर पराग तेलंग। मैं एक बोर्ड सर्टिफाइड प्लास्टिक सर्जन आहे और मैं इंडिया में मुंबई में प्रैक्टिस करता हूँ। आई कंसल्ट एट बुर्जिल अल रीम इन अबू धाबी। A type 3 forehead contouring is an important component of the facial feminization surgery. There are significant differences between a male forehead and a female forehead. A male forehead tends to be thicker in the middle part, which is called as a supraorbital rim, and this thickness continues all over the base of the eyebrow. A female forehead tends to be smoother and it tends to have a slope going backward. The male forehead also tends to be taller and larger than a female forehead. A female forehead tends to be smaller and smoother. These are important differences that we address when we do a type 3 forehead reconstruction. A type 3 forehead reconstruction involves removal of the outer part or outer table of the frontal bone, which is then shaved off on the table, and the bone in the surrounding areas is also shaved off. It depends on the thickness of the frontal bone and the size of the frontal sinus how much of a setback we can achieve by a type 3 forehead reconstruction. So this needs to be assessed preoperatively in order to ensure the best result for our patients. No, this procedure is essentially for those who have a prominent forehead bone or deep set eyes. So along with trans females, also cis females who have more projection on their forehead can opt for this procedure. Not always. The male forehead and the hairline tend to be different from the female forehead and hairline. The males tend to have an M pattern which is receding in the temporal areas. So most of the times a forehead contouring can be combined with a hairline advancement so that we can help a patient achieve the transition from a male to a female appearance. No, the surgery is done under general anesthesia wherein the patient does not feel any pain, and post procedure the patient of course is on painkillers which take care of whatever is the pain. As I said earlier, it is not always a part of facial feminization surgeries, but there are significant differences between a male forehead and a female forehead, and a type 3 forehead reconstruction gives a very good dramatic change to the appearance of the upper part of the face and thereby helps those who are transitioning from male to female. In a type 3 forehead reconstruction, the outer table of the frontal sinus or the frontal bone is cut and removed. This part of the bone is then shaved on the work table and then it is reattached or replaced, and it is fixed with the use of titanium screws or a titanium mesh. In the technique that we use at our center, I use a vascular flap called as a pericranial flap to cover this reconstruction, and in more than 250 cases of facial feminization done at our center, we have not had any problems with healing by the use of our technique. Yes, a type 3 forehead reconstruction can be combined with other facial feminization procedures such as a jaw shave, a tracheal shave, cheek implants, or any other procedures on the face. It is very safe to do a combination of these procedures, and depending on what are the needs of an individual patient, we can customize a plan to give the optimum results. If you found this video to be informative, please like and follow our Instagram handle, and we will keep you updated on the latest advances in facial feminization surgeries.